talking about better mental health and how to connect to services and resources in our community. What we have learned so far, family, is that there's no wrong door. There's just no wrong door. We have the Harris Center for Mental Health and IDD. We have Mental Health America of Greater Houston, and we have Kern here from NAMI, Greater Houston, and the Warmline and Resource Center. So I just want to get a little bit more defined on your services. So let's say you're thinking right now, you've been listening, and you're like, you know what? I need to call them. I have some service, but how much does this cost? Can anyone tell me, Karen, how much does your service cost?
Everything that we do is free.
It's free. All right. MHA?
Our service is free.
Free services, Jennifer?
Free 99.
Free 99. So look at that, family. You know, we think sometimes we're alone. We think people don't care. We think that we're isolated and we're just doomed to our own despair. But truly, there are people out here looking to connect with you. And that's our job right here on the amazing 102.5 Better Mental Health. We're here to connect you with services. So number one, they're free. Number two, do you have to have a diagnosis to call?
No.
No? No?
Nope.
No diagnosis. So if I think there's a problem, if I'm looking at a problem but don't know what to call it, if I think there's something permanent, temporary, or in between, whatever it is, I can call.
Yes.
As long as it's dealing with what?
Yeah.
Emotional, mental well-being, right?
That's right.
Not only mine, but
Your family,
friends, neighbors.
your pew buddy, that sister at church, that mother that lost her car and y'all haven't found it yet. Anything that deals with the brain, right? Something's going on. All right, no diagnosis. Now, Karen, you mentioned this earlier. How often do people call and know exactly what they want?
Not that often. I think people are in a situation where they need to have someone listen to them. And one of the things that we do is that we problem solve with people and try to help them think about next steps and then match them with resources that might be helpful.
And I'm going to ask everybody, is there a limit to how many times people, because I know I've answered the phone with you, Karen, and someone will say, you know, I talked to you a year ago. Somehow they just recognize my voice. I don't know what that is, but they'll say, I talked to you a year ago and you were helpful then, and hopefully you can be helpful now. So is it okay to call back?
Yes.
You encourage it.
Absolutely.
We had a situation not that long ago on the crisis line where somebody called and it was exactly what you just said, Angelina. The person who answered the phone was the same person who answered this person's call 10 years ago.
10 years ago.
And that person, it was such a meaningful experience and interaction for the caller that they immediately recognized this woman's voice and told her, you were instrumental in helping me make a decision to save my life 10 years ago.
Wow.
And I have been in treatment, you know, all this stuff, but today I'm struggling.
Right.
And I get chills telling the story.
Yeah.
And so I absolutely, you know, and believe in the power of connection and what Kern's been talking about is sometimes people just need and even if you have friends and family in your life who are really supportive, I talk about people calling us sometimes to workshop their story, right? Like they know something is going on, but they're not really sure how to talk. They want to talk to their friends and family about it, but they don't know the words to use.
The language, the vocabulary.
They haven't said it out loud to anybody yet. So it's kind of like they're practicing with us.
Yes,
and so on the crisis line, sometimes we'll even role play with people and we'll say, especially if we had one I'm thinking of a while back who is an LGBTQI plus community member who was in a situation where they were ready to tell somebody in their life about their life.
Right.
But they weren't sure what to do, and it was a family member and they were nervous about it. So we were like, pretend I'm your mom, talk to me like I'm your mom, and we'll practice. And what do you think is the worst thing that she's gonna say? Let's do that one first. Right? And then let's back it up into what do we think might actually happen? And it was such an amazing interaction and opportunity to really do some important work with our community members.
You know what? I'm going to stop you right there. I guarantee you the listeners on this call had no idea this type of support was available for themselves and to collect and gather information from others. So we are peeling back the layers because, family, we want you to know. We want you to know that people care, and we want you to know that there are other people, not just, it's not a one place ever that you can call. You can call many different places and you will be met with dignity and respect.
Yes.
And so no diagnosis, free, no insurance needed. I can call back how often I want to and how often I need to call. And so I'm going to start with you, Jennifer, and come back this way. And that is, what are the limitations? Are there any limitations on what you can do for callers?
Well, people are independent humans, right? So people are going to make their own choices about what their actions are going to be. So ultimately, at the end of the day, any one of us here, I'm going to answer for everybody, but then you go, any one of us can provide people with any number of things, right?
Right.
We can provide you with our time, our empathy, our care. We can provide you with phone numbers and mobile crisis referrals on our team. We can give you the names of therapists or what have you. But at the end of the day, as soon as that phone hangs up or that text is done, it's on the individual to make a decision about what's going to be right for them in that moment.
Absolutely.
And so, and that honestly is kind of one of the most frustrating parts of the job, right? Is that, when you know that there's this amazing thing that would be really helpful for somebody, but they're just not at the place in their experience to be able to utilize it yet. So a lot of it is us passing on what the limitation is for us as providers to not be frustrated in that space and to recognize how difficult change process is for folks,
Right.
and to be kind, caring, compassionate, and empathetic so that people will call back the next time when they think that they may be ready for maybe the next
You see why I asked Jennifer first, right? So now, would you have anything to add
I have
to it?
something to add.
Yes.
Actually, we had a caller yesterday, and I knew exactly how to help her. I was assisting our specialist kind of on the back end, like, make sure you ask this from a clinical perspective. What we unfortunately run into is barriers within the community, transportation, their ability to pay for medications.
Yes.
So even though I can get you seen by a psychiatrist, if I can't get you to the pharmacy or pay for those medications, it's kind of null and void. So what our program is looking at is, can we get funding? Can we get some dollars to supplement some of these other needs? We're experts in mental health, but we're not maybe experts in
Social
paying
services.
for, and swallowing kind of the ocean of Houston's needs. And it's drying up. And we're trying to get more creative on how do we access resources so people can get the help.
Absolutely. Absolutely. Anything to add?
Not as far as limitations, but the way we'll try to get around that, is by our collaborations with some of those providers in the community who are able to help with transportation or rent or
clothing.
That's right, whatever they need, and being able to provide warm handoffs to those services. So a lot of times, our resource specialists will say, okay, would you like us to transfer you right now? And they'll do that, make sure that they get connected so it doesn't get lost.
Right.
Shout out to our partners at 211, which is the United Way Information Referral Hotline, who is not at the table here with us today because they're not technically behavioral health. But I think you just heard that reaction. Every single one of us works with our partners at 211.
That's true.
For those day-to-day, basic needs. Yeah, food, clothing, shelter.
And that's a helpline too.
Yes,
right?
absolutely.
211 is a helpline.
Absolutely.
And you're right. I didn't think to invite them because they're not behavioral health, but it's usually the first line of defense. That'll be the first place people go, right? And Karen, any words to add to the limitations that we may have when people call us?
We offer a safe, non-judgmental space for people, and we want to meet everybody where they are. We offer that empathetic listening ear and then resource information, but we don't deal with crisis. We have to
Right. That is a big
have them connect with others.
Sure. So as soon as we recognize it's a crisis, we'll go to the crisis line. If they need more resources than what we have in our database, which is why we're so thankful to partner with your team with MHA in the Houston Harris County area, because we have a limited database, but you take us to another level with the list of providers and other resources. But don't you also follow back up with people to see if they tried?
Yes, we do. And often, and we always encourage whoever we talk to, whether it be a phone call, we also get emails from our website and requests for assistance from our website. But what we always encourage people to do is contact us again, and we reach back out, and we're available to be part of the journey.
All right, now we're going to take one more break, but we'll be right back because I want you to have a pen and a pencil ready and a paper so that you can learn how to get in touch with us. Be right back.